Welcome to today's video about symptoms of blocked arteries. What if the warning signs of a serious heart issue were right in front of you, but you brushed them off as stress or aging? What if that constant tiredness, short breath while climbing stairs, or chest tightness after a light workout wasn't just a bad day, but a ticking time bomb inside your arteries? Here's a chilling fact. Over 244 million people worldwide are living with coronary artery disease right now. And according to data from the World Health Organization, it remains the leading cause of death globally. But here's the part nobody talks about. Blocked arteries don't always scream for attention. The signs can be subtle, misleading, and dangerously easy to ignore. Why is this knowledge not widely known? Could it be because early symptoms like fatigue or jaw discomfort don't fit the dramatic image we expect of heart trouble? And if these signs were better recognized, how many lives could be saved? In today's video, we're diving into the hidden symptoms of blocked arteries, backed by real medical research and case studies. Stick around, because by the end, you'll know exactly what to look for, what the latest science says, and how you can take charge of your heart health starting today. And hey, drop your country in the comments. We love seeing where our viewers are tuning in from. Please note, this video is for informational purposes only and not a substitute for medical advice. All research is verified. References are linked in the description. All right, let's jump into the warning signs your body could be giving you, beginning with the very first clue. Frequent headaches. Persistent headaches, especially those that deviate from your usual pattern, might be more than just a nuisance. They could be signaling underlying vascular issues. Recent research underscores a notable association between migraines and an increased risk of cardiovascular events. A comprehensive longitudinal study conducted in Korea, encompassing over 45,000 individuals diagnosed with migraines, revealed that these patients had a 35% higher likelihood of experiencing strokes and a 31% increased risk of developing ischemic heart disease compared to those without migraines. This association persisted even after adjusting for traditional cardiovascular risk factors, suggesting a more direct link between migraine episodes and vascular health. One plausible explanation lies in the vascular nature of migraines. Migraines, particularly those accompanied by aura, involve complex neurovascular mechanisms that can affect blood vessel function. These vascular changes might contribute to the development of atherosclerosis, a condition characterized by the buildup of plaques in arterial walls, leading to narrowed or blocked arteries. Moreover, the inflammatory processes associated with migraines could play a role in endothelial dysfunction, further promoting arterial stiffness and plaque formation. This interplay between migraine-related vascular changes and atherosclerosis underscores the importance of considering persistent headaches as potential indicators of cardiovascular health issues. If you're experiencing frequent or unusual headaches, it's crucial to consult a healthcare professional. Early evaluation and appropriate management can help identify underlying conditions and mitigate the risk of serious cardiovascular events. Next, number 2. Visual disturbances. A sudden dimming or blurring of vision, especially in one eye, can be more than just an eye issue. It might be a sign of blocked arteries in your neck, specifically the carotid arteries. These arteries supply blood to your eyes and brain, and when they narrow due to plaque buildup, it can reduce blood flow to the retina. This reduction can lead to temporary vision loss, a condition known as amaurosis fugax, often described as a curtain descending over the visual field. Recent research highlights the importance of these visual symptoms. A study published in Frontiers in Neuroscience, 2024, found that ocular symptoms are often the initial indicators of internal carotid artery stenosis, or ICAS. The study emphasizes that inadequate blood flow due to ICAS can result in various eye conditions, including ocular ischemic syndrome and ischemic optic neuropathy. These findings underscore the need to take sudden visual disturbances seriously. If you experience such symptoms, it's crucial to seek medical attention promptly, as they could be early warnings of significant vascular issues that may lead to more severe events like strokes. Next, number 3. Slurred speech or facial drooping. When a blood clot blocks an artery in the brain, it can disrupt the neural pathways that control muscle movements, leading to noticeable changes in facial expressions and speech. This blockage, often occurring in the middle cerebral artery, affects areas responsible for motor control, resulting in one-sided facial drooping and slurred speech. These symptoms are not just physical anomalies, they are critical indicators of an ischemic stroke, where immediate medical attention is paramount. A study published in the American Academy of Neurology in 2025 highlights the urgency of recognizing these signs. The research emphasizes that symptoms like facial drooping and slurred speech, even if transient, should not be ignored, as they can signify a transient ischemic attack or a full-blown stroke. The study underscores the importance of early detection and intervention to prevent long-term neurological damage. Incorporating the BEFAST acronym Balance, Eyes, Face, Arms, Speech, Time into public awareness campaigns can aid in the prompt recognition of stroke symptoms. By understanding and acting upon these early warning signs, individuals can seek timely medical care, potentially mitigating the severe consequences of a stroke. Next, number 4. Hair loss on legs or feet. Noticing patches where hair no longer grows on your legs or feet? This subtle change might be more than just a cosmetic concern. It could signal an underlying issue with blood circulation. Peripheral artery disease, or PAD, is a condition where arteries, particularly in the legs, become narrowed due to plaque buildup. This narrowing restricts blood flow, depriving tissues, including hair follicles, of essential nutrients and oxygen. Without adequate nourishment, hair growth can slow or stop altogether, leading to noticeable hair loss in affected areas. An article from the Cleveland Clinic Journal of Medicine in 2023 highlights that while hair loss on the legs can be a sign of PAD, it's not a definitive diagnostic tool on its own. Other clinical signs, such as absent pulses or prolonged venous filling time, are also considered when evaluating for PAD. If you're experiencing unexplained hair loss on your legs or feet, it's essential to consult a healthcare professional. They can assess your symptoms in the context of your overall health and determine if further evaluation for PAD is necessary. Next, number 5. Leg cramps. While walking, you're out for a walk, and suddenly, a tight, burning sensation grips your calf. You pause, and the discomfort fades. Start walking again, and it returns. This recurring pain might be more than just a muscle cramp. It could be a sign of peripheral artery disease, a condition where narrowed arteries reduce blood flow to your limbs. PAD often manifests as intermittent claudication, characterized by muscle pain during activity that subsides with rest. This happens because narrowed arteries can't supply enough oxygen-rich blood to meet the muscle's increased demand during exercise. According to the Mayo Clinic, this pain typically occurs in the calves, but can also affect the thighs or buttocks. A study published in the Journal of Vascular Medicine found that individuals with PAD and exertional leg pain had significantly reduced walking distances compared to those without symptoms. This limitation isn't just about discomfort. It's a marker of underlying vascular issues that could lead to more severe complications if left unaddressed. Recognizing these symptoms early is crucial. If you experience recurring leg pain during walking that eases with rest, consult a healthcare professional. Early diagnosis and management of PAD can improve quality of life and reduce the risk of serious cardiovascular events. Next, number 6. Tingling or burning sensation in the feet or hands. A persistent tingling or burning feeling in your feet or hands might seem minor, but it can be a signal that your nerves aren't getting enough blood. This often happens when arteries become narrowed or blocked, reducing the oxygen and nutrients reaching your nerves. When blood flow is restricted, nerves can start to malfunction, leading to sensations like pins and needles, burning, or numbness. This is because nerves are highly sensitive to changes in their environment, especially to the lack of oxygen and nutrients. Over time, this can lead to more serious nerve damage. A 2025 study published in Signal Transduction and Targeted Therapy found that cardiovascular diseases and related risk factors, such as hypertension and atherosclerosis, impair blood flow to peripheral nerves, worsening neuropathic symptoms. The study highlights that chronic low-grade systemic inflammation elevates levels of C-reactive protein and pro-inflammatory cytokines, leading to endothelial dysfunction and nerve injury. If you're noticing these sensations, especially if you have risk factors like high blood pressure, high cholesterol, or a history of smoking, it's important to consult a healthcare professional. Early detection and management can help prevent further nerve damage and associated complications. Next, number 7. High blood pressure. When you notice unusually high blood pressure in your feet or hands, it's not just a random occurrence. It could be your body's early warning system signaling that something's amiss with your arteries. This phenomenon often points to a condition known as arterial stiffness. In this state, arteries lose their natural elasticity, making it harder for blood to flow smoothly. The result? Elevated blood pressure readings in your extremities. This stiffness can be an early indicator of atherosclerosis, where plaque builds up inside the arteries, narrowing them and restricting blood flow. A recent study published in the Journal of Vascular Health, 2024, found that individuals with higher systolic blood pressure readings in their limbs had a significantly increased risk of developing arterial blockages. The research highlighted that these elevated readings were not isolated incidents, but consistent markers of underlying vascular issues. It's essential to pay attention to these signs. Regular monitoring and early detection can lead to timely interventions, potentially preventing more severe complications down the line. If you observe such changes, consulting with a healthcare professional is crucial to assess and manage your cardiovascular health effectively. Next, number 8. Swollen feet or ankles. You know that feeling when your shoes feel tighter by the end of the day, or your socks leave marks on your ankles? That puffiness in your feet or hands might not just be from standing too long or the heat. It could be your body's way of signaling that your heart isn't pumping blood as effectively as it should. When the heart struggles to circulate blood efficiently, fluid can start to accumulate in the lower parts of your body, leading to swelling, a condition known as peripheral edema. This isn't just about discomfort. It's a sign that your circulatory system is under stress. Recent research highlights this connection. A 2023 study published in the Journal of the American College of Cardiology found that individuals with unexplained peripheral edema had a higher risk of developing heart failure within 5 years. This suggests that early swelling could be a warning sign of underlying heart issues. So, if you notice persistent swelling in your feet or hands, especially if it's accompanied by other symptoms like fatigue or shortness of breath, it's essential to consult a healthcare professional. Early detection and intervention can make a significant difference in managing heart health. Stay attentive to your body's signals. They're often the first indicators of your overall well-being. Next, number 9. Irregular heartbeat or palpitations. You might feel a strange fluttering or pulsing in your hands or feet and wonder, is this normal? While it might seem unrelated to your heart, These sensations can sometimes be early clues of blocked arteries. When arteries narrow due to plaque buildup, the heart works harder to pump blood, leading to irregular heart rhythms or palpitations. These irregularities can manifest as unusual sensations in various parts of the body, including the extremities. Such symptoms might indicate that the heart isn't receiving sufficient oxygen-rich blood, a condition known as myocardial ischemia. A study published in the Journal of the American Heart Association in 2018 found that individuals with peripheral artery disease had a higher incidence of atrial fibrillation, a common type of irregular heartbeat. This association suggests that symptoms like palpitations in the hands or feet could be linked to underlying arterial blockages. If you experience these sensations, especially during physical activity or stress, it's essential to consult a healthcare professional. Early detection and management of potential arterial blockages can prevent more severe cardiovascular events. Next, number 10, erectile dysfunction in men. When blood vessels narrow due to plaque buildup, it doesn't just affect the heart, it impacts the entire body. The arteries supplying the penis are particularly small, making them susceptible to reduced blood flow early on. This reduction can lead to difficulties in achieving or maintaining an erection, often serving as an early indicator of broader vascular issues. A 2023 study published in JACC Advances highlighted this connection. Researchers found that men with erectile dysfunction, or ED, had a significantly higher risk of cardiovascular events, including heart attacks and strokes. The study emphasized that ED often precedes these events by several years, suggesting that it can serve as a sentinel marker for underlying cardiovascular disease. This means that experiencing ED might not just be a quality-of-life issue, it could be a crucial warning sign. Addressing it promptly with a healthcare provider can lead to early detection of potential cardiovascular problems, allowing for interventions that may prevent more severe health outcomes down the line. Next, number 11. Slow-healing sores on legs or feet. When a wound on your leg or foot refuses to heal, it's more than just a nuisance. It could be a warning sign from your body. This persistent sore might indicate that your arteries are struggling to deliver enough blood to the area. Arteries are responsible for transporting oxygen-rich blood from the heart to various parts of the body. When these arteries become narrowed or blocked, blood flow diminishes, especially to the extremities like the legs and feet. Without adequate blood supply, even minor cuts or abrasions can become chronic wounds, as the necessary nutrients and oxygen for healing are in short supply. A recent study published in the International Wound Journal in 2025 highlighted that delayed diagnosis of arterial ulcers significantly hampers the healing process. The research emphasized the importance of early detection and intervention to improve outcomes for patients with these types of ulcers. These ulcers often appear on the toes, heels, or the outer side of the ankle. They may have a punched-out look with well-defined edges and can be quite painful. The surrounding skin might appear shiny, tight, or even hairless, indicating poor circulation. If you notice a sore on your leg or foot that's not healing, especially if it's accompanied by pain or changes in skin appearance, it's crucial to consult a healthcare professional. Early assessment can lead to interventions that restore blood flow, promote healing, and prevent more severe complications. Next, number 12. Arm or shoulder pain. You might not expect it, but that persistent ache in your shoulder or arm could be more than just a muscle strain. Recent studies have shown that such discomfort can sometimes signal underlying heart issues, even before more obvious symptoms like chest pain appear. In fact, a 2024 study published in BMC Cardiovascular Disorders found that 62% of patients with coronary artery disease reported pain in areas like the right shoulder, right arm, and back, locations not traditionally associated with heart problems. This non-classic pain was particularly prevalent among smokers and those with a history of heart disease. Consider the case of a 46-year-old man who visited the emergency department twice for persistent right shoulder pain. Initially diagnosed with a musculoskeletal issue, his condition was later identified as acute myocardial infarction, a heart attack. This case underscores how heart-related pain can be misattributed to other causes, delaying critical treatment. The reason behind this referred pain lies in the body's nervous system. The heart and shoulder share similar nerve pathways, so when the heart experiences distress, the pain can manifest in the shoulder or arm. This phenomenon is known as referred pain. It's essential to pay attention to such signals, especially if the pain is new, persistent, or occurs during physical activity. Early detection of heart issues can lead to timely intervention and better outcomes. Next, number 13. Pain in the neck, jaw, or back. Neck, jaw, or back pain might not immediately raise concerns about heart health. However, these discomforts can be early indicators of blocked arteries, especially in individuals with risk factors like high blood pressure, diabetes, or a family history of heart disease. This type of pain is known as referred pain. The heart and these areas share nerve pathways, so when the heart experiences stress due to reduced blood flow, the discomfort can manifest in the neck, jaw, or back. This is particularly common during physical exertion or emotional stress, when the heart's demand for oxygen increases. A study published in BMC Cardiovascular Disorders in 2024 found that patients with coronary artery disease often experience pain in areas like the neck, jaw, and back, highlighting the importance of recognizing these non-classic symptoms. It's crucial to pay attention to these signs, especially if they occur during activity and subside with rest. Such patterns can indicate that the heart isn't receiving enough oxygen-rich blood, a condition that can lead to serious complications if left unaddressed. If you or someone you know experiences unexplained pain in these areas, particularly during exertion, it's important to consult a healthcare professional. Early detection and management of heart-related issues can significantly improve outcomes and prevent more severe events like heart attacks. Next, number 14. Chest pain or angina. When your heart's blood vessels narrow due to plaque buildup, the heart muscle doesn't get enough oxygen-rich blood. This reduced blood flow can cause discomfort or pain, especially during physical activity or stress. It's your body's way of signaling that your heart is working harder but not receiving the oxygen it needs. This discomfort is often a warning sign of coronary artery disease, where arteries become clogged, restricting blood flow. Over time, this can lead to more severe conditions like heart attacks, if not addressed. Recognizing and responding to these early signs is crucial for preventing more serious heart issues. Recent studies emphasize the importance of early detection. For instance, a 2024 study published in the European Heart Journal highlighted that individuals experiencing chest discomfort, even without significant artery blockages, might still be at risk due to microvascular dysfunction. This condition affects the smaller blood vessels and can lead to similar symptoms, underscoring the need for comprehensive cardiac evaluations. If you notice such symptoms, it's essential to consult a healthcare professional promptly. Early intervention can make a significant difference in managing heart health and preventing complications. Next, number 15. Fatigue. Feeling unusually tired, even after a good night's sleep or minimal activity, might seem like a minor issue. However, recent research indicates it could be an early warning sign of something more serious. Blocked arteries. A 2023 study published in Frontiers in Psychiatry utilized Mendelian randomization, a genetic analysis method, to explore this connection. The researchers discovered that individuals reporting persistent fatigue had a higher risk of developing coronary artery disease including conditions like coronary artery atherosclerosis and myocardial infarction. Specifically, the study found that self-reported fatigue increased the risk of coronary artery atherosclerosis by 4.7% and myocardial infarction by 2.7%. This means that fatigue isn't just a symptom that follows heart disease, it might actually precede it. The heart, when struggling to receive adequate oxygen due to narrowed arteries, can't pump efficiently. This inefficiency can lead to a general sense of exhaustion, even during routine activities. It's also important to note that this symptom can be more pronounced in women. Research has shown that women are more likely to experience atypical symptoms of heart disease, such as fatigue, rather than the classic chest pain. This can lead to misdiagnoses or delays in treatment. If you find yourself persistently tired without a clear reason, it's essential to consult a healthcare professional. Early detection and intervention can make a significant difference in managing heart health. That's it for today's video on the hidden symptoms of blocked arteries. Thanks for sticking with us till the end. Now, we want to hear from you. Have you or someone you know ever experienced any of these signs? How did you manage it? Share your experience in the comments below. It could help someone else. And if this video gave you something valuable or opened your eyes to something new, type "helpful" in the comment box. That one word tells us we're on the right track and motivates us to keep creating more life-changing health content for you. Don't forget to like, subscribe, and hit the bell so you never miss our upcoming videos on heart health and beyond. Take care of your heart. It's the engine of your life. We'll see you in the next one.